When we talk about the collapse of the modern healthcare system, we usually focus on the insurance companies, the cost of drugs, or hospital wait times. But the real structural crisis is happening quietly at the bedside. Nurses today spend up to 35% of a 12-hour shift staring at a computer screen, clicking drop-down boxes, and fighting legacy software. We are taking the most highly trained, empathetic caregivers on the planet and turning them into data entry workers. Welcome to the Macro Cut. I'm Maeve.
And I'm Miles.
So, a few weeks ago, we received an incredible email from a long-time subscriber named Sarah. She's an RN working in a major trauma center, and she laid out a concept that completely stopped us in our tracks. The idea of digital moral injury, being forced to stay trapped behind a desk. Clicking boxes for insurance compliance while patients are actively calling for help down the hall.
Her email sent us straight down a massive research rabbit hole about hospital automation and AI. We instantly knew we needed her perspective for this episode, but like most nurses, her schedule is brutal. She's actually working a 12-hour shift right now, so we asked her to record a few video notes for us during her break. We asked her what the daily grind actually feels like. Roll her first clip.
Thanks for having me, guys. It's wild being on this side of the podcast. But honestly, I sent that email out of pure frustration. The technology promised to make our lives easier, but the reality is, the computer has become a wall between us and our patients.
That digital wall Sarah is talking about is a multi-billion-dollar structural bottleneck. Right now, hospital networks are pouring money into artificial intelligence, ambient listening devices, and mobile logistics robots to try and fix it. And while the public reaction is often complete fear that machines are going to strip the humanity out of medicine, the data we found shows the exact opposite.
To understand how we get this integration right for nurses like Sarah, we have to look at history. Because nursing has always been a data-driven battleground. Look at Florence Nightingale in the 1850s during the Crimean War. Everyone remembers her as the lady with the lamp, but her real superpower was statistics.
Nightingale realized the British government was operating on completely corrupted data. She meticulously counted the deaths and created the Rose diagram, one of the first data visualizations in history, to prove that far more soldiers were dying from preventable hospital infections and bad sanitation than from actual battlefield wounds. She used data as a weapon to force the bureaucracy to protect human life.
Then in the 1960s, a military nurse named Dr. Harriet Worley became the chief nurse researcher for the US Army. She saw that computers were going to revolutionize hospitals, so she went straight to IBM and sat down with their engineers.
Worley argued that computer scientists were building healthcare software entirely for insurance billing. She fought to create the nursing minimum dataset, proving that technology's primary job should be organizing data to lift the cognitive burden off the nurse, so they have the mental clarity to focus on the patient.
Nightingale and Worley laid the track. They showed that data should serve the caregiver, not choke them out. But today, the system has strayed completely from that mission. We asked Sarah what it's like trying to balance actual patient care with mandatory charting compliance. Roll the next clip.
If an AI ambient tool can securely listen to me talking to a patient and draft my charting notes in the background, it's a total game changer. It means I don't spend 2 hours typing narratives at the end of a shift. It gives me my time back at the bedside.
And that fear right there is the crux of the entire issue. Generative AI ambient tools have the potential to act as a true technological shield, wiping out screen time so the caregiver can actually stay physically present at the bedside.
But if administration treats AI purely as a tool for corporate optimization, they completely corrupt the purpose of the tech. Saving a nurse 2 hours of paperwork has to be an investment in patient safety and human empathy. That brings us to the second bottleneck, the balance between predictive algorithms and clinical instinct. Hospitals are now rolling out advanced AI triage models that scan patient vitals to predict life-threatening conditions like sepsis before they manifest.
On paper, it's incredible. The monitor flashes a red alert saying a patient has an 88% chance of crashing. But we looked at the data on automation bias. If a hospital relies too heavily on the machine, newer or severely overworked staff can fall into a trap where they ignore their own eyes because the screen says everything is fine. We asked Sarah how she views that boundary. Roll the clip.
A screen can tell you a lab number is off, but a screen can't smell an infection or feel how cold and clammy a patient's skin is when you hold their hand. A computer just doesn't know what it is to be human. And the subtle things that come with that is part of the diagnosis.
Exactly. A veteran nurse's clinical instinct, noticing a subtle change in skin tone or a shifting breathing rhythm, is the ultimate safety net of medicine. The AI must be treated as a secondary radar system to support their judgment, never to overrule it.
The third bottleneck we uncovered is purely physical, the sheer wear and tear of navigating a massive modern medical facility. We asked Sarah about the logistical burden of a standard shift. Roll her final clip.
The fear on the floor is that management will just use saved hours to give us more patients, speeding up the assembly line until staff completely breaks. We need the tech to absorb the physical burden, not speed us up.
What Sarah is hitting on is the physical exhaustion trap. Nurses waste miles of walking every shift hunting down IV pumps or hauling massive supply carts. To fix this, hospitals are starting to deploy autonomous logistics robots like Tug or Moxie to ride elevators and deliver lab samples directly to the floor.
Preserving a nurse's physical energy ensures that when they have to make a split-second, life-or-death clinical decision at 4 a.m., they aren't operating on absolute exhaustion.
This brings us right back to the core truth of this show. Whenever people look at hospital automation, they worry about a cold, dystopian future where a soulless machine manages your family's care without empathy.
But technology has no intent. An algorithm doesn't care about a patient. If our hospitals become cold and mechanized, it won't be because the AI is evil. It will be because corporate administrators chose to use technology to cut staff and maximize profit margins, rather than support their people. We, as a society, have full control over what we allow these tools to be. The implementation of AI in healthcare cannot be about squeezing more patients into a shift like cars on an assembly line just because the computer saved a nurse some paperwork. It has to be an intentional structural choice to restore the dignity of the profession.
Strict staffing ratio laws, ethical guardrails for medical software, and nursing-led data design aren't just red tape. They are the human boundaries that ensure AI is used as a shield to protect our caregivers, never as a weapon to commodify them. We want to give a massive thank you to Sarah for recording those notes for us between her rounds.
The lesson of Florence Nightingale and Harriet Worley is that data is only useful if it serves humanity at the bedside. If we integrate these AI tools correctly, one step at a time, we use technology to strip away the digital paperwork, the logistical chaos, and the crushing administrative weight.
So that our nurses can finally get back to doing the one thing a computer will never be able to replicate:
being human.
If you want to keep diving into the real structural economics behind technology and labor with us, hit that subscribe button. Let us know your thoughts on hospital automation in the comments below, and we'll see you next week for the survival guide on the macro cut. You can also find us at NYAM78 on Substack to read the companion piece to this show.